This is Inside Urology, Cutting to the Chase, a podcast from the Indiana University School of Medicine Department of Urology. We talk about all things urology with Dr. Clint Cary. Each episode features conversations with physicians, researchers, patients, and we'll share some of the stories shaping the field. So let's cut right to the chase. Hello, welcome to the very first episode of Inside Urology, Cutting to the Chase. I'm Annie, your host, and I'm here with Dr. Clint Cary from the Department of Urology here at IU School of Medicine. Hi, Clint.
Hi, Annie. How are you doing?
I'm doing great. I'm excited for our first episode. How do you feel?
I'm excited. We've been planning this for a while. I've been chair of the program now for a little over a year. This was one of my many visions I had of things I wanted to do to upgrade the department and connect us back to many different stakeholders, whether it's our own physicians, our patients, our alumni, really whoever that this resonates with. I've been looking forward to this. It's been a bit of a planning process, and so I'm glad that today is here and looking forward to the conversation.
And this is new to both of us, so, spare us a little bit here as we kind of take on this task and this exciting new adventure for us.
Yeah, we're joining the myriad of other podcasts out there, and so I know there's some other urology podcasts. I believe we may be the only department-specific podcast, so we may be venturing out into our own waters, and we'll see how this lands with people, and we certainly will learn things along the way, both good and bad.
Let's do it. Let's cut right to the chase. Let's learn a little bit about you, Clint. What's your background? How did you get here as chair?
That's that we could have a whole podcast on this question, but to keep things moving along, so I'll start. I guess first and foremost, I married with 3 kids. My wife is the engine of the Cary machine, I would say. We have 3 kids that are actively involved in many things, and so without her helping shuttle these kids around to all the events and things they're at, I would not be able to focus on what we're doing here, the job, my profession, without her. So that would be first and foremost. Going back a little bit further, my background, I grew up in a very small town in Tennessee of about 400 people. And so it's a big change from growing up in a small town to this position leading one of the country's most historic urology department. And so, there's a lot that comes along that journey. I was blessed with great parents that helped instill in me the work ethic and a lot of things along the way. Many great friends and colleagues. And really, I think what set me on a path to be in this seat today is this program here and the mentors that I met when I came through as residency. And some of them are now colleagues still in the department. And so this department played a big role in the position that I'm in shaping me to have the confidence to do this and the skill set to be the surgeon I am.
So why IU?
I still, for those who don't know, obviously there's going to be a lot of medical folks that listen to this, but for those who aren't, you go through medical school and then you decide which specialty you go in, and then you interview around the various programs around the country and decide which ones you like and which ones like you, and there's the whole match process. And so I still very vividly remember my interview here on campus at Indiana University. I still remember the tour we took, the walks, the feel of the place. There was something that grabbed me about IU that's hard to put into words, but it's just a feeling that I belonged here, or this place was right for me. And a lot of that came from the environment that was here, the surgical volume that was here, the mentorship, the leaders in the field, the place that our department holds in the history of urology, which we'll get into a little bit later about some of the advances that we've done. It was all of that, and it was also kind of the work ethic and kind of down to earth mentality that was here, where okay, we've done great things, but we're normal people as well, and that resonated with me.
When you first came here, did you imagine being now chair at any point in that, thinking that that was going to be your path?
The quick answer is absolutely not. We just had resident interviews for the match process that I just described, and so we just went through that a few weeks ago. And that's one of the things I told to the interview applicants, is that I was sitting in all their seats 20 some years ago, and there was no thought in my mind that I was going to be the chair of this program, or really any program. And so I think that speaks to the opportunity that this place provides. Will set you up for success no matter what your goals are. Some of the people that I trained with in my class are very successful private practice urologists, and obviously we set you up for that as well. But I suppose if you do have goals of being a chair, this place will do that for you as well.
So why urology? Like, what makes you passionate about it?
So I didn't know that I wanted to do urology when I came into medical school. I grew up playing sports and was around sports a lot, and I thought, kind of a natural progression of that is being an orthopedic surgeon. I knew I wanted to do something in the surgical field. Orthopedic surgery seemed to make the most sense. And then as you kind of go along and get more knowledge and get more experience on a variety of rotations, I just realized that I wanted to do something a little different than orthopedic surgery provided. I started to experiment around. I did obviously general surgery rotations as a medical student. I did all the surgical subspecialties to a degree that was available. And urology was something that had a mixture of things. We do a lot of different types of technology. We have a lot of gadgets. We have big surgeries. We have small surgeries. We have patients in clinic that are patients of ours for sometimes our whole career. I still have patients that I saw my very first month in practice. And so you build those relationships over time. And so it just had a lot of variety in it. The surgeries were very diverse. We had a lot of technology, whether it's endoscopic procedures, robotic procedures, laparoscopic procedures, open procedures, microscopic procedures. There's just so many different things that can draw you in. And I think that's probably what spoke to me.
What's the most fulfilling thing for you in this field?
Obviously, I mean, that's going to, in clinical practice, obviously it's going to come down to patient care. My practice is pretty specialized and specific. I take care of, a majority of my practice is taking care of men with metastatic testicular cancer. That is a legacy part of our program here at Indiana University. I've been fortunate enough that people have had confidence in me to train me and help carry that torch. And that I get emails back of patients that I've operated on. That we get patients that come here from all over the country, if not the world, and a lot of times they're coming for very complicated surgeries, and to get responses back, emails, letters about things that they're doing now, that's pretty rewarding to know that you're making an impact on guys that have the next 50 years of their life in front of them. I just had a email back from a patient's father, actually, that I had operated on. And when I operated on him, he was a Division I college swimmer. And now he's made it through that, and now he is swimming for the Coast Guard, and he's jumping out of helicopters in the ocean saving people. So knowing that, obviously, that was his passion and his drive, but knowing that I provided a little bit of him being able to do that by getting him through a complicated surgery is very rewarding.
Maybe let's go back to kind of a basic question for maybe some listeners who don't really know what urology is, kind of a broad answer for them. What would you say?
It's a good question. They're not in that boat alone. I wasn't sure I knew exactly what urology was when I showed up to medical school. It is a diverse field. I mean, I think what a lot of what we do is restore patients' quality of life from a urinary standpoint. mean, it ranges from taking care of patients with kidney stones to um, women with urinary incontinence, men with urinary incontinence, men with enlarged prostates that have difficulty urinating. Pediatric urology should be mentioned in this, and kids that are born with congenital problems. Um, we help restore normal anatomy for them. We help men with future fertility plans or difficulty with fertility. Uh, we from an oncologic side of things, we are able to cure a lot of patients with cancer. Obviously, if it's found early enough, whether that be kidney, bladder, prostate, or testicular cancer. And so there's a lot of rewarding parts of our job where we can help patients through a problem, sometimes through very delicate conversations of what's going on with them. And I think there's a lot of, the people in our group and urologists in general take a lot of pride in that.
So let's circle back about the department in general. Tell us a little bit about how we got here, some of our, major accomplishments that got us to where we are here today.
So our department, I feel very honored to be the chair of this department. I think anyone would. We've had a very prominent place in the field of urology since we started. Our department, we're the oldest urology practice in the United States, not necessarily the oldest department, but the oldest practice in the United States, started back in the late 1800s. Over that time, we've been blessed with having great surgeons and great innovators and great thinkers. I'll just name off a few and then we can come back. I mean, obviously one of our most well-known accomplishments has been in the field of testicular cancer. That actually started in our department with a previous chairman of ours, John Donahue, who was working on developing a surgery to help cure men with metastatic testicular cancer. And this was back in an era when chemotherapy didn't exist. And so he was doing these very complicated surgeries, figuring out the anatomy back then, and then fortunately, Larry Einhorn came along and they partnered together. And the combination of those two working in a very multidisciplinary fashion really is what led to the revolutionary cure of testis cancer. And then they spent the next 20 years of their career at least figuring out what's the right chemotherapy regimen, what's the right sequence of surgery versus chemotherapy, or chemotherapy versus surgery in that order. And in that process, we have grown our experience, and patients still come to see us from all over the world because of that. And we're fortunate that we've been able to pass that knowledge down from generational surgeon to generational surgeon. And so we still provide that extremely high-level care for those patients. That's probably what we're most known for, obviously very proud of. But we have a lot of other things that we've done in this department. In pediatrics, a combination of pediatric urologists and adult urologists developed the Indiana pouch. So that's a urinary diversion, sometimes used in pediatrics for kids born with these congenital anomalies. And it's been brought over for the adult population, whether they have very bad ureteral stricture disease or urethral stricture disease, and certainly in the bladder cancer population, when you remove the bladder, this is now a bladder replacement or substitution option where patients don't have to wear a bag on the outside. So that was a pretty big advance for patients in their quality of life. That happened in the late 80s, early 90s. Our field of endourology, we've been pioneers in this. We were the first program to offer the HOLUP procedure, which is holmium laser enucleation of the prostate for men with benign enlargement of their prostate. We were the first in the U.S. to do this. We had a faculty member that went over to learn how to do this overseas and then bring this back. And we were the first to publish on the first U.S. experience in that. And since then, that program has just continued to grow. We were one of the first locations in the country to have the lithotripter, which was a non-invasive way to take care of kidney stones, which was revolutionary back in the 80s. We were one of the first programs in the Midwest to do a percutaneous stone surgery. So these are large advances in kidney stone care, where patients used to have these massive incisions to take kidney stones out, little tiny stones, and now we can do that with either no incisions or an incision smaller than your fingertip. We were the first in the state to do robotic surgery. program developed what's called high-intensity focused ultrasound treatment for prostate cancer. We worked with the original company to develop this, test this on some benign prostate treatments, and then now this has become a standard of care option for men with prostate cancer. We worked with what is now known as Pluvicto, that we treat men with advanced metastatic prostate cancer. We worked with the original company in a very early stage to understand what this agent can do, which then eventually led to the development of this treatment for men with metastatic cancer. So I think we could go on and on here, but I think the point is we've always had great innovators. We've had great surgeons, people that are curious about how to improve the quality of care for patients, and that's what's made our program legendary, and that's what the mindset we're going to take forward into the next decade or so more.
So we have a lot going on in the department, as you just said. We could talk about this for hours and hours. But what's the goal of this podcast? Why should people be listening? What do you hope people take from the podcast?
Well, I hope this is going to be a dynamic podcast. I don't want it to be, number one, boring. But I want it just to provide a lens into IU urology. Obviously, we just talked about a lot of the things that our department has done over the many decades. We still have people that are just as hungry and interested in changing people's lives. To get an insight into what we're doing on a daily and weekly basis, we'll try to stay current, cover any current topics that come up, let people know, get a lens into the research that we're doing, and really what it takes to run a top-notch program. And hear some of the stories on a daily basis of what makes us, us.
We're excited to do it. Yeah. Well, thank you, Clint, for joining us. We will have you on the podcast quite a bit, if not most of our podcasts, and we look forward to it. So thank you for joining us.
Thank you for having me. Very excited. Hopefully we didn't mess things up too bad today.
I think we did okay. Thanks for joining us on this episode of Inside Urology. Make sure to follow, subscribe, and share this episode with someone who might like an inside look at the world of urology. And stay tuned as we keep cutting to the chase.